My name is Sarah Grady, and I will be discussing the management of depression. The objectives of this presentation include: number 1, recognize the symptoms of major depressive disorder. 2, describe challenges associated with diagnosis and treatment of depression. 3, apply existing diagnostic recommendations and criteria to practice in the management of depression. 4, describe the mechanism of action for all antidepressants. 5, list antidepressants most likely associated with the following: sedation, sexual side effects, weight gain, hepatotoxicity, increased blood pressure, and seizures. 6, discuss time course to therapeutic effect for antidepressants, as well as potential duration of therapy. And 7, review appropriate antidepressant combinations, as well as switching strategies. Epidemiology. Depression is the largest source of medical disability for Americans between the ages of 15 and 44 years of age. The annual prevalence of depression is believed to be 6.6%. And although more individuals are receiving treatment for depression these days, the morbidity and mortality for depression has not changed much in the past 2 decades, unfortunately. Depression is oftentimes undertreated and untreated. And additionally, significant racial and ethnic differences exist in the diagnosis as well as the treatment of depression. So there's definitely challenges to the treatment for depression. Now we'll discuss a patient case. A 24-year-old woman presents to the clinic with complaints of insomnia, low appetite, low energy, decreased concentration, and depressed mood. She has been feeling this way for about 2 months, and she reports missing several days of work over the past month. Her past medical history is significant for seizures. She reports being managed well with Keppra for several years, but does report that her last seizure was 6 months ago. She states the seizure was most likely due to missing a few doses of the Keppra plus drinking excessive alcohol around the same time. She states this incident scared her and that she no longer drinks alcohol and misses very few doses of Keppra as a result of this experience. She also takes an oral contraceptive daily, and her toxicology screen today is normal. So a couple questions regarding this case. The first question: this patient's clinical symptoms are most consistent with which of the following diagnoses? A, major depression. B, dysthymia. C, depression not otherwise specified. Or D, a substance-induced mood disorder. Next question. After further discussion with this patient, you believe she may have major depression. Prior to beginning antidepressants, which of the following laboratory tests or diagnostic tests should be completed? A, a CPK. B, an EKG. C, TSH. Or D, CMP. Next question. All the laboratory tests that you completed came back within normal limits, and the patient agrees that antidepressant therapy might be helpful for her. So which of the following would you recommend at this time? A, bupropion. B, desvenlafaxine. C, paroxetine. Or D, trazodone. And last question for this case. When educating the patient about the average antidepressant time course, which of the following symptoms will likely improve first? Appetite, concentration, anhedonia, or mood? The Diagnostic and Statistical Manual, DSM-4 criteria for depression is the following. An individual must have 5 or more symptoms over a 2-week time period. Additionally,